Last week saw the overturning of Roe v. Wade. It had enshrined legal access to abortion in 1973 in the US, and its repeal will lead to almost total bans on abortion in about half of the US states. Though the decision was leaked a few weeks ago, somehow it was still no less shocking when officially announced last Friday. Other than some celebrations from right wing politicians, the reaction in Canada has been mostly an outpouring of grief and expressions of solidarity. And, it has to be said, a bit of Canadian self satisfaction. Today, to talk about the situation in Canada, we're joined by longtime reproductive justice activist Darrah Teitel. Darrah is a former organizer with Action Canada for Sexual Health and Rights and currently a labor organizer with the Amalgamated Transit Union. Darrah, thanks for joining us.
My pleasure.
What do you make of this emerging discourse that we've seen about people starting up underground railroads from the US to, our land of supposedly abundant abortions?
Yeah, honestly, it makes me a little pukey. Just the smugness and the self-satisfaction that we are once again exhibiting towards our comrades in the States. And, it comes from a noble place of wanting to help, but it shows a total lack of understanding, firstly, of the health system and how much money and time and resources is necessary in order to take somebody from a location where they can't get an abortion and get them an appointment someplace across a border, even, let alone in another state or province. This is something that we worked with firsthand at Action Canada for Sexual Health and Rights. We ran the Norma Scarborough Fund and a 24-hour access line where we would have to book abortions for people in Canada who often could not find abortions anywhere close to where they lived. And it would cost thousands and thousands of dollars. And it would often be with people who were really desperate and who would stumble upon our resource to be able to find it. But like hundreds and thousands of women cannot find those resources on a regular basis, right? Like it only stands to reason. It's a very niche service that we provide. And so, knowing intimately what the details are of abortion tourism, as it's called, I know how difficult and strategically damn near impossible it would be for us to run that kind of underground railroad up to Canada. And then you have the problem of the fact that we don't have any resources to deliver these services to Canadian women. So why are we expecting that Health Canada and the services in Health Canada, despite what Minister Karina Gold said, which was like, you're all welcome here. And I was like, oh, really? Who's paying for this? You can't even muster up a few $100,000 to pay for services in most clinics inside of Canada. So who's paying for it? How are you getting through the migration process difficulties? How is anybody without a passport supposed to get a passport? And then who's going to pay for the travel, the childcare, the lost wages for these people who can't find abortion? So no, this is not a solution. It's sweet, but it's not a solution. And I think it's smug for Canadians to be suggesting that to Americans.
And I understand that when you were working at Action Canada, the abortion tourism would extend often to sending Canadians to the States, in fact.
Oh, yeah, absolutely. I mean, we had a lot of interprovincial travel for sure, because there are whole provinces in Canada where it's almost impossible to get an abortion. The Maritimes is a nightmare, like the entire east coast of Canada. It's really hard to get any kind of abortion services. But then after you get to a certain term limit, like after a few weeks of being pregnant, then we were forced to send people down to the States because in a very practical sense, there are a lot more providers willing to do abortions in later terms in America than there are in Canada.
I actually have a graphic. Let's throw that on the screen. It actually shows provincial term limits for abortion in Canada. So
that's bad.
In weeks of pregnancy when you can no longer actually get an abortion. Do you want to help break down the meaning of this graph for us?
Well, I mean, it just shows that we don't have people who are willing, either for legal terms or because of the hospital regulations, or just because they can't get a provider who knows how to do these procedures in most places in Canada that go over 20 weeks. So you're sending people all the time to Quebec and BC that have a provider that will do it. And I'm talking one. It's not like it's available all over the province or easily across the province. And then there are places like whole swaths of territory, like the north, where there's nothing. And in provinces like New Brunswick, Newfoundland, Nova Scotia, and PEI, it's incredibly low term limits. Like we're talking 10, 12 15 weeks, thereabouts, right? And these are provinces that are also like incredibly under-resourced when it comes to having providers who can provide abortion. And I'll go back to abortion medication because that is a solution for access in a huge way. Pills can be delivered through nurses and any doctor across the country in rural and remote places where people wouldn't have access to others. But we do have very few providers who feel willing to take on that role as a provider or who offer that as an option. And there's a lack of education in general. So that's something the federal government can help with and also isn't, which is to, take on a big information campaign. That would be extremely helpful.
I want to ask you about a specific situation. We have a clip we're going to play from last summer when the Liberals made an announcement in New Brunswick where provincial Conservative government has stopped funding an abortion clinic 554 in Fredericton.
Access to surgical abortions is a flashpoint in New Brunswick. The province is the only one that doesn't fund out-of-hospital surgical abortions, which are only available at hospitals in Moncton and Bathurst. But 2 years ago, the Prime Minister promised that would change. Then just 11 days ago, Deputy Prime Minister Chrystia Freeland reaffirmed that promise.
We all have the right to access to those services. Our government is absolutely clear on that, and we are very clear about a woman's right to choose.
So, the usual Liberal, song and dance seems positive. What's going on in New Brunswick, and what has been the Liberal government's response?
Okay, so let's start with the fact that for over 30 years, the province of New Brunswick has been standing in flagrant opposition, disavowal of the Supreme Court of Canada's decision when it comes to Morgentaler. For many, many years, they still had therapeutic abortion committees there where you would need a doctor's signature in order to prove that the life or health of a woman is at risk in order to get an abortion. And more than that, and this is the thing that is consistent till today, they have what is known as Regulation now I'm forgetting. Regulation 8420. That's it. Regulation 8420, which is a simple regulation inside of their Health Act, which says that they will not be funding abortions, covering the cost of abortions, the way that we are all entitled to public health care in this country, outside of hospitals. And so that means that the Morgentaler Clinic there that has existed for many years was operating out of necessity as a private clinic and went under, some 8 to 10 years ago. And then it was rescued by a group of feminist activists who crowdfunded in order to keep it alive. It became Clinic 554. Some extremely dedicated healthcare professionals, took it over, came from BC, made it their life's work to move to New Brunswick and make that clinic operate. And they started providing trans healthcare and other sexual rights and healthcare there, which was really awesome. But it is an unsustainable financial endeavor. And so this was laid at the doorstep of the federal government over the course of successive minority and majority governments of late, and still nothing was done for many, many, many years. And then finally, as if, the thought had sprung out of their forehead like Zeus, they're like, oh, why don't we use the Canada Health Act in order to, well, they didn't say that, we said, use the Canada Health Act, use the stick part of this, deny them funding from the Canada Health Transfers unless they come in line with our legislation. And they did. And they denied them $100,000 or something along that line, right? And I think they did this once, twice. Anyhow, it's a completely negligible amount of money. It did absolutely nothing to move the needle. And abortion remains completely inaccessible, while the clinic, I think, is just like by the skin of their teeth hanging in there through charitable donations.
More broadly, what does this and generally how the Liberal government interacts with feminist organizations tell us about, what their abiding agenda is?
It gets them the 30-second TV spot. It gets them the ability to stand in front of the clinic wearing a giant L. And in doing so, it makes things seem like they are okay or they're going to be okay while things remain totally, totally not okay. And it has this dangerous demobilizing effect on the people who are, credibly concerned about what's going on. I don't think you have to be cynical to sort of see what's going on there, right? Like, the Prime Minister knows that 70% of people would want action on this if they understood the story. And when activists bring it to the point where the public does understand the story, the fact that you can't get an abortion in PEI is like on everybody's lips. The fact that everybody who calls themselves a feminist now knows what Clinic 554 is. They realize they have to say something, and they can exploit that lefty energy, and then they co-opt it. And in doing so, the irony, like, as if the co-optation isn't bad enough, and like taking the work and the words of activists is not bad enough, they also don't do anything about it. So it's this whole bait and switch, and it's really dangerous, and it's the liberal climate that we live under here in Canada.